I have asked the patient to put on a gown and empty her bladder for this exam. I have taken her vital signs, height, weight, and tested her distant vision using the Snellen chart and her near vision using the Rosenbaum chart, which is testing cranial nerve number 2. As she walks in the room, I am going to take note on her appearance and her gait. I have washed my hands and am ready to begin the exam. My name is Lauren, and I'm going to be doing a head-to-toe assessment today, and I will be talking to the camera as we go through this. First, I'm going to inspect the skin on her face. Skin is pink and intact. There are no lesions. Her skin is warm to touch. Her skin turgor is elastic. Her eyes, ears, and nose are symmetrical. Her head is normocephalic, and she is able to hold her head in an erect position. Next, I'm going to test cranial nerve number 7 by asking you to clench your teeth, wrinkle your forehead, close your eyes tightly, smile, stick out your tongue, and puff your cheeks. Her cranial nerve 7 is intact. I'm now going to palpate her scalp. Is there any tenderness?
No.
There are no masses or lesions felt. Her hair is healthy. There's no coarseness or no alopecia. I'm going to now palpate your facial bones. Is there any pain or tenderness?
No.
And then also palpate her sinus regions, frontal and maxillary. Any pain or tenderness?
No.
Her sinus regions and facial bones are intact. Next, her temporomandibular joint. Open and close for me. Any pain or tenderness?
No.
There are no pops or clicks noted, which is a normal finding of TMJ. Next, I'm going to test light sensation by using a Q-tip and asking her to tell me sharp or soft. This is testing cranial nerve number 5, trigeminal nerve. So I'm going to test this on her cheeks, forehead, and chin. So soft or sharp?
Sharp. 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 Soft. Soft.
Her trigeminal nerve is intact. Next, I'm going to inspect her eyes. I'm looking at her eyebrows and her eyelashes and her eyelids. There are no lesions. There's no drainage, swelling. They're symmetrical. I'm going to look at her conjunctiva. It is pink and moist. Her sclera is white, and there's no signs of jaundice. I'm going to now test her pupillary response. So I'm going to have her stare straight ahead. And with my pen light, I'm going to shine it into her eyes. Pupils are 3, equal and brisk, and they respond to the light. I'm now going to ask her to close your eyes tightly shut, and I'm going to palpate the lacrimal apparatus. Is there any pain or tenderness?
No.
There is no drainage or oozing or crusting out of the corner of her eyes. Now I'm going to do the cover-uncover test. So can you look straight ahead and cover one eye? Uncover. Now cover the other eye and uncover. Her eyes stayed straight and even, and there are no signs of strabismus or nystagmus noted. I'm now going to test the 6 cardinal fields of gaze, which is cranial nerve 3, 4, and 6, by asking her to follow my pen light. Her 6 fields of gaze, cranial nerves 3, 4, and 6, are intact. Now I'm going to inspect her ears. They are symmetrical, and the top of her auricle is even with the outer canthus of her eyes, which means they are not low set. Do you feel any pain or tenderness as I touch?
No.
I'm now going to use the otoscope and look at her tympanic membrane. I'm going to do this by pulling her auricle up and back. Her tympanic membrane is pearly gray. There's no redness or drainage. I'm going to do the same, pulling this up and back. And there's no redness, drainage, and tympanic membrane is pearly gray. Next, I'm going to test cranial nerve number 8 by doing the whisper test. I'm going to stand behind her and ask her to cover one ear and repeat a series of letters or numbers. Okay, so can you cover your left ear?
ABC.
And then cover your right ear.
1, 2, 3.
So her cranial nerve number 8 is intact. Next, I'm going to use the tuning fork and do the Weber test. I'm going to strike this and place it on top of her head and ask her if she can hear equally on both sides. Can you hear equally?
Yes.
Okay. Next, I'm going to do the Rhine test, which tests air conduction versus bone conduction. So I'm going to strike the fork again and place it on her mastoid bone and ask her to tell me when it stops.
Okay.
And then I'm going to place the other end in front of her ear and ask her to tell me when this stops, and this is testing air conduction. Her air conduction was 2 times longer than bone conduction, which is a normal finding. Next, I'm going to inspect her nose. Her nose is symmetrical, is pink and intact. There's no deviation. I'm going to use the otoscope again and look into her nose. Membranes are pink and moist and intact. There is no blueness or bogginess, which would indicate allergies. Now I'm going to check the patency. Can you cover one nostril, close one nostril, and breathe? Can you breathe normally?
Yes.
And then the other nostril? Breathe. Can you breathe normally?
Yes.
If she had any trouble breathing, this would be a sign of turbinate dysfunction. I'm now going to inspect her mouth. First, looking at her lips, there are no cracks, fissures. They're moist, pink, and intact. So then I'm going to ask her to open the inside of her mouth. The anterior and posterior pillars are intact. Soft, hard palate, tonsils, and uvula, and the posterior pharynx are all intact. I'm going to ask you to touch your tongue, so repeat your mouth. I am looking under her tongue for any lesions or ulcers. There are none noted, but that would be an indication of oral cancer. Her tongue, can you stick your tongue up for me? Her tongue is pink and smooth. There is no coating, and there is no edema. I'm going to look at her teeth. Her teeth are white. There's no signs of teeth decay, no fillings. There's no foul or fruity odor coming from her mouth. There are no missing or loose teeth. I'm now going to test cranial nerve number 9 by asking her to stick out her tongue and say ah. While looking in the back of her mouth, her uvula rises, which is a normal finding, and cranial nerve 9 is intact. Next, I'm going to do cranial nerve number 10, which is the gag reflex. Her cranial nerve 10 is intact. Now I'm going to inspect her neck. Neck is symmetrical. There's no jugular venous distension. Can you shrug your shoulders for me? And that just tested cranial nerve number 11. Her cranial nerve 11 is intact. I'm going to test your range of motion. Can you put your neck back and now forward? And then to the left side, and now to the right side. And then against resistance. Push against my hand. Good. Now against my hand this way. Good. And then So she has good muscle strength in her neck, good range of motion. There's no signs of muscle atrophy. I'm now going to palpate the carotid muscles of the neck, each side, but one at a time. Her carotid pulses are equal and strong. There's no thrill. I'm now looking at her trachea. Her trachea is midline. There's no signs of deviation. Can you swallow for me? Her thyroid rose up when she swallowed, which is a normal finding. I'm now going to palpate her lymph nodes. First her occipital, then her pre-auricle, now her post-auricle, tonsillar, submandibular, submental, posterior cervical chain, superficial cervical chain, deep cervical chain, and supramandibular, clavicular. Was there any pain or tenderness?
No.
And there was no swelling of her lymph nodes. Next, I'm going to auscultate with the bell of my stethoscope over her carotid and her thyroid. I'm going to ask you to take a deep breath. Good. Breathe normally. Take another deep breath for me. Good. Breathe normally. I'm going to auscultate over the thyroid. While I was auscultating, I was listening for bruits, and there were none noted. Bruits over the carotid would indicate stenosis, and bruits over the thyroid would indicate hyperthyroidism and need for further evaluation. Now I'm going to inspect her extremities. So I'm going to ask you to, upper extremities, I'm going to ask you to hold your arms out. There's good muscle mass and tone. They are equal and symmetrical. Skin is pink and intact. I'm going to look at her nails. Cap refill is less than 3 seconds. There is no signs of clubbing. Go ahead and put your arms down. I'm now going to check her radial and brachial pulses. They're both equal and strong. Rate is regular. I'm now going to go to her back. I'm looking at her posterior chest. Skin is pink and warm. There's no signs of there's no sign. Her lumbar, her vertebrae is intact. Now I'm going to ask you to stand up and bend over for me. I am looking at her vertebrae, and it looks like she has some mild scoliosis in the lower lumbar area. Stand back up for me. Can you twist side to side? And now bend side to side. So I was just testing her range of motion, and it looks like she's strong, and no signs of muscle atrophy. I'm now going to palpate and percuss over the costovertebral angle, noting any pain. Is there any pain or tenderness?
No.
Okay, now I'm going to listen to her lungs over the lateral and posterior parts of her chest. Can you take a deep breath for me? Good. Lung sounds are clear throughout. Respirations are unlabored and equal. There's no signs of any respiratory distress or use of accessory muscles. I'm now going to palpate for tactile fremitus. So I'm going to place my hands on your back, and when you say 99,
99,
and again,
99,
and again.
99.
She had equal expansion of her lungs, and there's no tactile fremitus noted. I'm now going to percuss over the posterior and lateral chest walls. Resonance is noted. You lift your arms up for me. Resonance is noted, which is a normal finding over healthy lung tissue. Next, I'm going to test her diaphragmatic excursion by asking her to exhale and hold it. Now I'm going to percuss down the right side. And this should change from resonance to dullness. And there it is right there. I'm going to mark that, and then I'm going to percuss up. Ask her to inhale and hold it. I'm going to mark that area. That space in between is about 3 centimeters, which is a normal finding. Normal finding is in between 3 to 5 centimeters. Next, I'm going to move to the anterior chest. I'm going to inspect her anterior chest. Skin is warm and intact. I'm going to palpate her precordium for pulsations, thrills, or heaves, and there are none noted. There is no signs of distress or use of accessory muscles. I'm also going to palpate her apical. Right, it is regular and strong. Next, I'm going to percuss her anterior chest, her subclavicular line, down to her 6th rib. And resonance is noted bilaterally. I'm now going to listen to her lung sounds. Ask you to take a few deep breaths. Another one. Lung sounds are clear throughout. I'm also going to listen to the 5 heart sounds: aortic, pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 are present, and there is no audible murmurs, rubs, or thrills heard. Now I'm going to ask her to lay down. I'm going to inspect her abdomen. Lift your shirt up a little bit here. So her abdomen is non-distended. There is no bulges. Skin is pink and intact. As she inhales, it is symmetric. There is a small pulsation for aorta, but that is normal finding in thin individuals and does not indicate aortic aneurysm. I'm now going to auscultate, listening for bowel sounds in all 4 quadrants. Bowel sounds are present. Before stating that she has no bowel sounds, I would have to listen for at least 5 minutes. I'm also going to auscultate her aortic artery, her renal arteries, her iliac, and her femoral arteries. There was no bruise heard on auscultation. Next, I'm going to lightly palpate her abdomen. Any pain or tenderness?
No.
And there is no crepitus felt. And then I'm going to deeply palpate the right costal margin for her liver. And the liver border is felt right here. And now I'm going to deep palpate the left side, left costal margin for her spleen. Her spleen is not felt, which is also a normal finding. If her spleen was felt, that would mean it was enlarged. Next, I'm going to deep palpate the kidneys. There's no guarding or grimacing displayed by the patient. And now I'm going to percuss down the right side until dullness is noted. Which is right here. The liver is about 10 centimeters, and that is a normal finding. And now on the left side, down the axillary line to the intercostal space, and there's no resonance noticed over here. Okay, you can sit back up. I'm now going to inspect her legs. Can you scoot back a little bit for me? There's no signs of atrophy. It is pink and intact. Skin is warm. Muscle is well defined. There is no hair in her legs, which is normal for her. She shaves her legs. I'm going to palpate her dorsalis pedis pulses. They are equal and strong bilaterally. Posterior tibial pulse. They are also strong, regular, and equal bilaterally. And then her popliteal. They are strong, regular, in rhythm. I'm now going to test her reflexes. Her knee, just get up for me. Her knee, brachial, and Achilles tendon. So first her knee, and that is intact. And then her right knee, good. And then her brachial, just let this loosely hang, good. Now her right brachial, those are intact. And now her Achilles tendon, can you turn around for me? Bend over, there you go. Okay, the left Achilles tendon is intact. Now the right. So our reflexes are present, and that concludes our exam. Thank you.